Social egg freezing is a condition where a lady might choose to preserve her eggs for preserving her fertility for future use. This is usually resorted to by patients where they have approached a stage in life where they are aware of the fact that with increasing age, their egg quality and number is going to decline. But they have not yet found the right partner, or they feel that even if they have found the right partner, this is not the right time in their careers where they can pay enough attention to their family. So it's optional. Social freezing is an excellent option for such ladies where they want to preserve their fertility for future use. This is most commonly, or in fact most usefully opted to when you are less than 37 years old. What is done in this particular case? Well, you would need to consult your infertility expert who will then determine what is your ovarian reserve. The treatment cycle usually involves starting from around the second day of the menstrual cycle, where the patient is given hormonal injections on almost a daily basis. Normally these injections would last for about 10 to 12 days. And then once we see that the follicles which contain the eggs have grown to a size of about 17 to about 18 millimeters on ultrasound scan, the patient is given a trigger shot for the maturity of these eggs. Approximately 34 to 36 hours after the trigger shot, the patient will undergo an oocyte retrieval procedure, which is done generally under general anesthesia. This is a daycare procedure. You are usually called empty stomach in the morning, and by afternoon you should be fit to go home. What is done thereafter is, during the procedure, you will undergo an oocyte retrieval, which is done with the help of a needle under ultrasound guidance transvaginally through your vagina. There will be no cut on your abdomen, and then these oocytes which are retrieved will be frozen in the laboratory. The oocytes can be easily frozen for up to 5 to 10 years. Later in life, where you feel that you are ready to start a family, you can come to us, and then we can combine the eggs. We can fertilize the eggs with your partner's sperm. In case if you are still single, you can select a donor sperm, and that donor sperm can be used to fertilize your eggs. The embryos can be cultured in the laboratory for up to 3 to 5 days, and then they can be transferred in your uterus when we feel that the lining is adequate. For how long can you freeze your eggs? You can freeze your eggs for almost up to about 5 to 10 years based on your preference. However, it's important to understand that as a female's age increases, pregnancy also tends to be high risk. So it's better that you are aware of this fact before planning your pregnancy. Another thing that you need to be aware of is that as per Indian laws, you can undergo an IVF treatment only if you are less than 50 years old. So please do keep this important fact in mind before you resort to social freezing. How much does this entire procedure cost? Well, the procedure can cost anywhere between about 1.5 to about 2.5 lakhs, depending upon how many injections you need, what is the dosage of injections, what is the stimulation protocol which you undergo, what is your age, and how many cycles of ovarian stimulation you might need. For someone who has less number of eggs, you might need more than one cycle of stimulation to get adequate number of eggs. So, how many eggs is enough? Well, it's usually advisable that you freeze at least about 15 to 20 oocytes so that we have a good chance of getting healthy embryos for you in the future. Another question which patients tend to ask very commonly is it better to freeze oocytes or embryos? Well, in case if you have a steady partner, it will always be better if you freeze your oocytes as embryos after fertilization with their sperm, because the survival of embryos has a marginal edge over that of eggs. However, with improvement in vitrification techniques, oocyte retrieval has also seen a significant improvement, and it's almost as safe as embryos. But still, if you are in a steady relationship and you're confident about your partner, it would be better to freeze your eggs as embryos.